NHIS in a week, where we give you the highlights and happenings of the authority and the scheme. My name is Shama. Now the headlines. NHIS CEO commissions Shama District Office. NHIS boosts operations in Western Region with new vehicles. NHIS CEO launches Keep Fit and Wellness Clubs in Central and Western Region. In a move to enhance access to healthcare, the authority has commissioned a new district office in Shama. The ceremony, held on August 1st, 2024, was marked by the presence of the NHIS CEO, Dr. Da Costa Abuaje, who shared his vision for the future of healthcare in Ghana.
The newly built NHIS office in Shama is a step forward improving healthcare delivery in the district. During the commissioning, Dr. Da Costa Abuaje, CEO of the NHIA, emphasized the authority's achievements over the past 2 decades.
I am so glad today to be commissioning the 5th of our offices across the country in less than 4 months in office. But let me, at this point, narrate some of the new innovations that the NHI management and board are championing within the last few months. And we believe that these innovations in our 20-year history will change the healthcare architecture in our country. In consultation with the President, the Vice President, and government officials, the NHIA in last 2 days brought on board a new initiative which will be part of our benefit package called the annual health check, which is free for all Ghanaians to enjoy.
He also outlined a bold 4-point vision focusing on promotive and preventive healthcare, eliminating illegal charges at health facilities, issuing Ghana cards to children aged 6 to 14, and extending NHIS coverage to visitors. The District Chief Executive for Shama, Mr. Dazi, praised the NHIS efforts and called for the proper maintenance of the new office.
This milestone marks a significant step in our effort to enhance access to quality healthcare for the people of Shama District. This edifice is not merely a structure of bricks and mortar. It is a testament to our collective commitment to improving the health and well-being of citizens in the district. I would like to remind the management of the facility to ensure proper maintenance of the building.
He also acknowledged the innovative tools like the NHIS short code *929# and the My NHIS app, which have made the scheme more vibrant and accessible.
With the help of the government, led by His Excellency Nana Addo Dankwa Akufo-Addo, you can now link your NHIS card to your Ghana card. This means you can access medical care anytime, anywhere, without stress.
The event saw attendance from several key figures, including the NHI Regional Operations Manager, Mr. Kwabena Techi Arthur, who welcomed the CEO and called for the completion of other projects in the region. Other notable attendees included Mr. Oswald Esuamensa, Acting Director of Corporate Affairs Directorate, Mrs. Eva Okai, Acting Director of Human Resources, and Mr. Bernard Brown.
Moving to Takrade, the operations of the National Health Insurance Authority, NHIA, received a significant boost with the presentation of 2 brand new Toyota pickups. The vehicles were handed over to the Amenfi West District Office and the Western Regional Office as part of the NHI's ongoing efforts to enhance efficiency and service delivery.
At the short but significant ceremony, NHI CEO Dr. Da Costa Abuaje, accompanied by several directors, officially handed over the vehicles to Mr. Kwabena Techi Arthur, the Western Regional Operations Manager. This initiative underscores the management's commitment to operational excellence and improving community service. Mr. Techi Arthur, expressing his gratitude, promised that the vehicles will be well maintained and utilized to achieve their intended purpose. These new vehicles are expected to greatly enhance the operational capabilities of the NHIA in the Western region, as well as ensure better service delivery for all.
The CEO, Dr. Da Costa Abuaje, officially launched the Central and Western regions Keep Fit and Wellness Clubs. The ceremony saw NHIS staff from both regions coming together for the exercise training session.
Dressed in NHIS branded t-shirts, the NHIS staff participated in a health walk through Thakrade's principal street, celebrating and raising awareness for the new preventive and promotive health policy added to the NHI benefits package. The event featured jogging exercise and aerobics, with Dr. Abuaje himself joining in. In his address, Dr. Abuaje highlighted executive management's vision to promote a healthy lifestyle among citizens through regular exercise to prevent diseases like high blood pressure and diabetes.
As a country, preventive health care has also been missing for the last 20 years on the NHIS benefit package, except some vertical programs of preventive immunization that normally happens. So recognizing this, we also know that our cost burden is becoming very high. And by this, we really want to take action to reduce our cost burden and to make sure that Ghanaians actually live longer. We are imbibing the culture of exercise, physical activity, and good nutrition in the general population. But by doing this, we are starting with our staff. So across the country, we are forming NHIS fitness clubs across the country, and the districts will have what we call the district offices will have what we call the health corners or the fitness corners. They are supposed to link up in such a way that every week they do a little bit of physical activity, stretch, and they are supposed to take good nutrition, so they will be receiving counseling and other services as well.
Still in the news, the CEO also announced a comprehensive staff welfare policy during his visit to the Western and Central region as part of his staff engagement tour.
NHIS CEO Dr. Da Costa Abuaje, the board chair Dr. NSKP Kwaku, and other directors revealed plans for a comprehensive health insurance policy covering staff and their immediate families, as well as extensive HR reforms. These reforms include new appointments in HR, the development of a scheme of service for automatic promotions, and filling critical vacancies nationwide.
This one, I give credit to the board for making sure that there is an insurance scheme in place, plus the 5% top-up that the NHIS is not covering for yourselves, your spouses, your children under the age of 25. Any institution without priority to its staff, to me, is dumb. Because at the end of the day, when you take care of your staff and they are working well, me as the head, I only take glory. Then everybody will be saying, ayo, 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 ayo. Is that not the case? So, it is in my interest and the interest of the board to take care of your welfare. And also, let's not forget the government, because at the end of the day, it's the government that is providing money for NHIS. We are not in isolation. So let's clap for the government.
Dr. Abuaje also introduced the annual health check program and called for support in the upcoming implementation plans.
Currently, hypertension, diabetes are our most cost drivers. In fact, it's getting to a tipping point and we need to take action. And the whole world, if care is not taken, will also experience the next pandemic, which is the non-communicable diseases. The best way to tackle the non-communicable diseases is what? Early detection. It is the reason why the NHIS, or government through the NHIS, has launched the free annual health check where all Ghanaians will be given the opportunity to seek basic health check once a year on their month of birth. It is important. In fact, we stand to benefit because at the end of the day, we are the payer. So if we are able to force the system to reduce our cost burden in terms of hypertension, diabetes, we save more money and put it into your welfare. Is that not the case?
The Chief Executive, Dr. Da Costa Abuaje, and Board Chair, Dr. NSKP Kwaku, also held a stakeholder engagement session in Takoradi to discuss NHI's reforms and the integration of promotive and preventive health measures into the benefit package. The meeting included key players from the health sector, civil society organizations, and the media, and focused on enhancing the efficiency and effectiveness of the National Health Insurance Scheme to better serve Ghanaians. The reforms discussed aim to improve service delivery, ensure financial sustainability, and expand the range of services covered by the NHIS. A significant emphasis was placed on shifting from merely treating diseases to preventing them through early intervention, health education, and lifestyle changes, thereby reducing healthcare costs and improving public health. Stakeholders expressed strong support for these initiatives and underscored the need for public awareness and education for their successful implementation. The NHIA also gathered feedback on integrating these reforms into the existing healthcare system with a commitment to continue collaborating with stakeholders to monitor and ensure the success of these reforms nationwide.
The National Health Insurance Authority and the Pharmacy Council have taken a significant step forward in enhancing healthcare delivery in Ghana. Stakeholder engagements were held in Takoradi and Koforidua to discuss the implementation of the National Electronic Pharmacy Platform, or NEP for short, a new tool designed to revolutionize prescription management in the country.
On July 16th in Takoradi and July 23rd in Koforidua, healthcare leaders gathered to deliberate on the National Electronic Pharmacy Platform, an innovative tool set to enhance the efficiency of prescription processing. The NEPP, which aims to strengthen pharmacies as key components of community healthcare, is expected to increase enrollment in the National Health Insurance Scheme by making healthcare services more accessible and effective. In Koforidua, Reverend Ben Boko, the Eastern Regional Manager of the Pharmacy Council, highlighted the technological advancements the platform will bring to pharmaceutical services across the nation. Stakeholders, including NHIS Senior Corporate Affairs Manager, Madam Efua Brago Mafo, also voiced their support, emphasizing the NEPP's role in improving the quality of healthcare in Ghana.
Now to our final story. The Greater Accra Regional Office of the NHIA kicked off its health promotion and wellness campaign, aligning with the vision of NHIA Chief Executive Dr. Da Costa Abuaje. The campaign aims to encourage Ghanaians to adopt a healthier lifestyle. Up next is Preventive Health segment.
This week, we take a look at diabetes. Diabetes is a chronic medical condition where the body either doesn't produce enough insulin or can't effectively use the insulin it produces, leading to high levels of glucose in the blood. To prevent diabetes, you need to 1. Maintain a healthy diet. Focus on eating whole grains, fruits, vegetables, lean proteins, and healthy fats while limiting sugar and refined carbs. 2. Exercise regularly. Aim for at least 30 minutes of moderate physical activity most days of the week to maintain a healthy weight and improve insulin sensitivity. 3. Maintain a healthy weight. Losing even a small amount of weight can significantly reduce the risk of diabetes. 4. Stay hydrated. Drink plenty of water and avoid sugary drinks. 5. Avoid smoking. Smoking increases the risk of diabetes and other health complications. 6. Monitor blood sugar levels. Regularly check blood sugar levels, especially if you have risk factors for diabetes. Lastly, get regular medical checkups. Routine health screenings can help detect early signs of diabetes and allow for timely intervention.
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you son a line, tin.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
That's all that we have for you in this week's edition of NHIS in a Week. For more news, please visit our website www.nhia.gov.gh, and you can visit our social media handles displayed on your screen. My name is Shanice Palm. Have a good week.